Hello guys, welcome to my YouTube channel. It's Abdul here. Today I will speak about a condition that's very common and that I have been suffering with for the last year, which is anterior pelvic tilt. Anterior pelvic tilt is when the pelvic, which includes your hips and pubic bones, moves slightly forward or tilt. This can lead to a series of symptoms such as a strained lower back, a very bad posture, and hip pain. This happens due to a muscle imbalance in your lower body, usually a combination of weak and tight muscles. In my case, my hamstrings and abs were the weak muscles and my quadriceps and hip flexors were very strong. Typical characteristics include forward tilt, visible lower back arch, glutes that stick out, and weak abdominal muscles. The overactive and strong muscles are usually your hip flexors, which are the small muscles in the front groin area, your quadriceps, which is your front thigh muscles, and also tight back extensors. The weak muscles that can cause problems are your glutes, which is your buttock muscle, hamstring, the muscle at the back of your thigh, and your lower ab muscles, rectus abdominis. It is also sometimes called Donald Duck syndrome. Now that you understand what it is, you're probably wondering how to fix it. So step 1, you need to realize that no type of drug or medicine will help you other than temporarily pain relief. You need to start self-medicating, and by this I do not mean taking more tablets and medicine. I mean that you need to actually start stretching and strengthen your body. Don't wait for a magic pill. To fix this will take time. Accept it and get started. Once we understand that we need to self-medicate, we can now move forward and determine if you can posterior pelvic tilt. If you cannot hold posterior pelvic tilt for 20 seconds, focus on stretching exercises. If you can, focus on strengthening exercises. Now I'm going to show you how to posterior pelvic tilt. As you can see, I am currently in anterior pelvic tilt, but once I tighten my lower abdominal muscles and my glutes and then push my hips forward, I am currently in posterior pelvic tilt. You should hold this for 20 seconds. Do this exercise multiple times, as this is the first step in trying to get better and self-medicate. Now I'm going to show you two of my favorite stretching exercises for your tight muscles. They are standing quadriceps stretch and a hip flexor stretch. The first one I'm going to show you is a standing quadriceps stretch. You simply stand on one leg and pull your other leg backwards. You hold this for 20 seconds. Remember that this is not a balancing exercise, this is a stretching exercise, so if you need to hold a wall or a chair or something, go ahead and do that. Don't forget to hold this for 20 seconds. The second one I'm going to show you is a seated hip flexor stretch. You simply sit on your knees, take one of your legs forward, and then you engage your core and your glute muscles and you slowly lean forward. You hold this for about 20 seconds. It's very important that you engage your core and glutes. You should hold this for about 20 seconds. Once you have done that, you swap legs and you do the other leg for 20 seconds. Do this multiple times, as this is also a very good exercise to help relax your hip flexors. Now I'm going to show you two of my favorite strengthening exercises for anterior pelvic tilt. The first one is hollow body hold, which is a core exercise, and the second one is glute bridges, which are a lower body exercise. So to do hollow body hold, you lie flat on your back. Remember to keep your lower back on the ground, keep your hands straight in the air, tuck your knees in and engage your core. Don't forget to keep your belly button engaged and tucked inwards. Keep your core tight. Keep breathing. Don't forget to breathe and hold for about 20 seconds. If you would like to make this exercise a little bit harder, I would suggest you to stretch your legs out and keep your hands up in the air, straight up in the air instead of forward. Keep this for about 20 seconds also. It's a very good core exercise, very simple to do, and is very suitable for beginners. The second exercise are glute bridges. You just simply lie flat on your back, Raise your hips as high as possible, remembering to engage your core to protect the lower back. Do this multiple times and hold for about 20 seconds on each rep. It's a very good lower body exercise to help you strengthen your glutes and your lower body. Be patient, things will improve. Do the exercises consistently and you will get better. Remember, this takes time. I would like to say thank you very much for watching. Leave a thumbs up and a like, and I hope you have a great day.